lumbar spine rotations as a passive accessory. So this is a motion that the patient can't do, remember. Passive physiological they can, so they could do the techniques that are in my other videos, but these they can't do for themselves. These are also a fantastic technique. They are extremely versatile and really help a lot of patients with a lot of conditions. So for a lumbar spine rotation, what we're going to do is we need to set them up for the position that we need the lumbar spine to move in. And to do that, we need to come underneath their legs, placing their knees against our hip. With our other hand, we're going to find the top of the iliac crest and line it up. That then should be L4. Now whichever region we want to work on, remember we're always mobilising a joint. So it could be between L4 and L3, in which case those two fingers there become very important. Or it could be between L3 and L2, in which case it could be those two fingers. Equally, I could just move my fingers up. If you prefer using index as one of your fingers for feeling, then that's fine. So what we have here now is L3 and L2. Then what we need to do is we're going to flex and extend their lumbar spine via their pelvis. And start off with, do a nice broad motion. You should be feeling for how much motion they've got in that region. So Malcolm, nice and mobile in here. Come slightly further down. Nice and relaxed for me. So yeah, I can feel this point here. What we're feeling for is, if that's the two spinous processes, and my fingers are on them there, then as I bring his knees up towards me, he flexes. So the spinous processes separate. And as I push his legs back down so that his lumbar spine goes into extension, those spinous processes come together. What we're feeling for, so as I'm flexing and extending, this should be happening. That tells me if it's mobile. It might not be. You could be flexing and extending and it stays nice and static, in which case it's very stiff and you would mark that down. But equally what we're looking for is we don't want that region, that joint, to be extended or to be flexed, because then it's closed pack. We want it to be right in the middle, so it's not flexed or extended, it's here, which is where it's at its most mobile. That then means when we perform our rotation, it should occur in this joint. So those spinous processes should flip over across one another like that. Flexion into rotation in either direction. There is only 1 degree obviously at this level. The other rule, the other way of thinking about that, so you can feel for it, fantastic. What if it's really stiff? How would you know? Well, in general, we would be looking at that if the thigh was up at 90 degrees, we are in the L5-S1 region. And if the thigh was down to 45 degrees, so kind of down here, lower than I've got it here, then we'd be in the L1 to L2 region. Again, can't stress enough, that's a rough guide. It gives you an idea. It's not an exact science because everyone's anatomy is different. But at least it gives you that guide. So here we've set it up for L2-3. So it's kind of, slightly flexed off the lower regions. That's absolutely fine. And that is now set for performing my rotation. When performing my grade 1s, we want their head nice and supported with pillows under here. If that's not enough, we can always pop something else underneath. We want the spine to be nice and neutral. So I'm also going to bring his head back so that it's neutralised in there. You can see that we have quite a wide set of shoulders. So we do have a little bit of a curve in here. I could spend quite a bit of time kind of trying to straighten this out. For the purposes of the camera, I'm not going to, but that might be something we would look at for this patient. What we're then going to do is grade 1 position. We're just going to pop the forearm onto the hip there. Okay? Other hand underneath is just nice and relaxed down. Then we can perform our mobilisation. We put one hand on the shoulder, which really we're just resting that arm, that hand on the shoulder, no pulling forces. This hand goes onto the pelvis. Okay, so we've got greater trochanter and we've got the iliac crest in here. The hand goes on and we're getting to this pushing position. So I'm in walk standing, so one foot's in front of the other. Hand goes onto there. This hand goes onto the shoulder. It's just resting, remember. And I'm going to apply a force down and through the femur. You need to make sure that they're far enough on the bed that they're not going to roll off. And certainly in this position here, I might just, so just stay as you are, patient, might just flex that up. If I feel I've got a little bit of a twist going on, then of course I can neutralise that just with a pillow. So adjustment is key. And ask them, obviously. Ask them if they're comfortable. From here then, hold and apply our force. So we push in and then we back off, make sure that it didn't cause any pain, and then we just rotate. Nice and fluidic, no jerking, gradual, gentle mobilisation. But a reasonable bit of force in my right hand here. Not lots, but just enough that it pushes their pelvis over. For grade 2, what we're going to do is we're going to bring this hand back to the pelvis. By doing that, look, it's just dropped the shoulder back a little bit. So now we've counter-rotated from above. Hand goes back over the top. We're not pulling on it, I'm just placing it there just to stabilise. This hand into here, and then the same thing. For grade 3, now we've got to twist them. So we're going to twist them from underneath. What we're going to do is we're going to take hold of this hand. Their hand goes onto my elbow, and my hand goes onto their elbow. So we're locked together. We ask them just to grip onto our arm, onto our elbow. My other hand is going to go underneath, so just above the shoulder, between the neck and the shoulder, and it's going to come through. And I'm going to pull it down and onto their, so in this instance, their left scapula. Okay, so my hand goes through, there it is, and then down onto the scapula. Okay, now, I'll get myself in nice and close into the bed. I don't want to be leaning backwards, so nice and close into the bed. Firm grip on the scapula, firm grip onto the elbow, letting them know that I'm going to lift them, which will twist their torso around. I'm going to do that on the count of 3, but it will be a nice fluidic movement. No jerking and no trying to go like this and kind of jog them as if you're going to take them, twist them off the bed. Okay? Are you ready? So I'm going to count of 3. I'm going to do it one nice movement. Let me do the movement, you stay nice and relaxed. If it hurts, you just tell me and I'll pause and push you back. 1, 2, 3. So look, no fast movement. Up, see how I'm lifting from here, and then I rest down. Now this hand comes onto the top hand. Look at what's happened, see how it's twisted that pelvis round. So now we don't need this. Pop that down over there. That's back on top. And look at the twist that's doing now. Now you can see why this is the grade 3 position, because it's really twisting from above. So now our motion, let's have a look here as well, that's probably not ideal. Let's drop that down, it's because we've got a patient who's got nice broad shoulders. Relax for me. Their comfort is key. Hand back onto the shoulder, holding. Now we're going to have a bit more of a force pushing down and backwards, because we want to hold them down into this position. Hand back onto the hip. I've got to say on the earlier clips as well, by the way, you direct your force down the femur wherever it is. So if it's up there, you push that way. If it's down there, you push that way. Onto here, holding that shoulder down, and now I apply a pressure through. More pressure needed now. It's grade 3, isn't it? Okay. Okay. For grade 4, same setup here. What we do though is we take this leg and we take it over the leg that's underneath. Look at that now. So now the leg is weighing forward, twisting the pelvis round. The shoulders are twisting the thoracic spine back round. So imagine that torque between below and above. That's why it's a grade 4. We're pushing them to the end of range. Fix, hand on. Now the femur's moved, I follow the femur. So I adjust my direction of force, load them up, and then gently rock. No doing it really violently or thrusting or anything like that, just a nice pendulum effect. And there we go. Of course, from there you need to unwind them. Don't leave them there and say, okay, all done, jump up. So we unwind them. You can, of course, unwind them in the way you did, so that would be just like this, leg on top of the other one. I could then come here and go underneath there, other hand on top of the shoulder, and twist him round. Okay, so I'd lift here and pull from underneath to twist him onto his side. Or, so it all depends upon the patient and what they prefer, which position they prefer to be in. Or I can put him onto his back. So to do that, it's hand onto hip, other hand goes underneath the knees. Okay, so I'm underneath his left knee, then the creases in the knees goes into my forearm, this hand goes onto the pelvis, and then from there what we do is I lift the knees towards me and push the pelvis underneath. We do this in a 1, 2, 3 motion. Are you ready? 1, 2, 3, and I lift and push, so we push them onto their back, legs are settled, and then we gradually give them their legs back. So now they're back into a neutral position, supine. Or as I said, their legs are over and you twist their shoulders back so they go back onto their side. It depends upon the patient. And that's lumbar spine rotation, passive